Now the causes and the recalls as a clinical station of thyroid examination. While you are telling that your child, the thyroid status is euthyroid, as clinically there is no tremor, pulse is normal, there is no fever, and there is no sign of hyper or hypothyroidism on examination, so it may be a case of euthyroid state. So, what may be the causes of euthyroid? Maybe it is iron deficiency, Hashimoto, simple colloid goiter, or Whittington. And then the question is what will be the investigation? Investigation, first of all, the thyroid function test, serum TSH, free T4, T3, and then the thyroid antibody testing. If euthyroid or clinical suspicious of hypothyroidism, so anti-thyroid peroxidase TPO or anti-thyroglobulin. And if it is suspected case of hyperthyroidism, so the antibody testing will be thyroid receptor antibody. And then ultrasonography of thyroid gland as imaging, and in ultrasonography we can calculate the volume, and sonographic characteristics may be help us, such as the moth-eaten appearance, which may be found in Hashimoto thyroiditis, cyst may be found in colloid goiter, and if any nodule which is very small, which is not detected during the examination, may be found by this ultrasonography. So number 2 is imaging ultrasonography, and number 3 is radionuclide uptake and skin. Usually we done in case of Graves' disease with toxic nodular or hot nodule, and other investigation, bone age and sleep lamp examination if there is exposure keratitis. And after investigation, what is the management? If it is simple goiter, so reassurance, but if it is weak treatment, so levothyroxine, treatment with levothyroxine. So causes of the painful thyroid gland, this may be case of infection, puberty, and during who will do the biopsy? Usually interventional radiologist will do the biopsy, and histopathologist will give the report. And when we suspect is thyroid malignancy, so thyroid malignancy we can suspect if during examination, if it is hard, irregular, tender, attached to the underlying structure associated with cervical lymphadenopathy, retrosternal extension, audible breath. Okay, and in recall, another is how to examine for proximal myopathy. We will ask the child to raise hand up and not allow me to put it down. So, and then DD of midline swelling, this is better written in the Reham's note, and these are all about, and which are the risk factor for thyroid malignancy: any radiation, genetic factor, multiple endocrine neoplasia, plus any thyroglossal cyst, congenital goiter, autoimmune such as Hashimoto or Graves' disease may be risk factor for thyroid malignancy. And it's better to know what is the interpretation of radio iodide uptake test. If in case there is a nil or decreased uptake, so this is destructive thyroiditis. If there is increased uptake, this is Graves' disease. If there is focal uptake, so autonomous functioning adenoma. If more than one focal uptake, so this is toxic multinodular goiter. And this all about the the recalls question from thyroid examination. Thank you.